Good afternoon, everybody. Thank you for being here. We'll go through some data, a couple different updates, and then I'll take some questions. Overall, the data, for the most part, is very positive. Hospital numbers, we have 96 residents in the hospital. Coming off of a weekend, that's not a bad number. Last week we were over 100. Usually midweek, the hospitals get caught up on discharges, and so we expect that number to get lower, same trend. 26 residents are in the ICU, so please keep them in your thoughts and prayers. 88% of those residents are unvaccinated. So that's continues to be the story for those who question the vaccine, the efficacy. It does a pretty good job at keeping you out of the hospital, and a really good job at keeping you out of the ICU room. Looking at, unfortunately, the loss of life is a lagging indicator. Over the last 3 days, we lost 3 residents in the community. All had underlying conditions. Some people ask why we talk about that. Couple reasons. One, it's in the medical report that's done, so we just relay the medical report. But the people are correct that people are in the hospital with something else, and they may test positive for COVID, and they do count in loss of life numbers, just like they count in hospital numbers, even though COVID may not have been the driving factor. If you think about General Powell, who was a role model of mine, he was very sick, got COVID, very complicated. Anyone who has COVID that passes counts in a COVID number. But we lost 3 residents, which is horrible. One in their 30s, one in their 70s, and one in their 90s, all males. More positive news. Last week, from Monday through Sunday, week over week, we've been following. We've seen 3 straight weeks where we flattened and started to dip a little bit. 2 weeks ago, we had 1,546 cases from Monday through Sunday. Last week, we had 1,062. That's a 31% decline in cases. That's drastic, and that's very positive. Our Saturday number was 94. Our Sunday number was 174. Today's number is 103 to start out our new week. That's down from 204 at the previous time last week. So the cases are starting to go in the right direction. That's what we've seen in other parts of the country with the Delta variant, is once they flatten, they start to bend, in some cases pretty quickly. Out of today's cases, staggering 43% are household contacts. Again, that's tended to be the case here with the Delta variant, is that most of the transmission is happening within the homes. It's a more contagious variant than what we had in the beginning, so it's harder to isolate, to keep everyone isolated and avoid transmission within the home. When you look at under 29, 32% of under 29 of today's cases were under 29 years old. 32% of the cases were under 29. So overall, case-wise, we're off to a good start this week. It was really important week for us as we start to move into colder weather. People move indoors more. Certainly we're excited about people participating in the vaccine boosters, and also certainly as we get to the kids, we'll talk about that in a minute. 2 announcements here. The Moderna vaccine for a booster has been approved. On Thursday at the On Center from 9 to 4, we will have a Moderna booster clinic in partnership with Kinney Drugs. The link to register for this is on our website. So Thursday will be Moderna. Friday we will do another Pfizer booster clinic at the On Center from 9 to 4. Again, in partnership with Kinney Drugs. That link is also on the website. So please, I know people have reached out to me about the Moderna. Please go get registered on gov.net, and we'll see you on Thursday. And then for those for the Pfizer, same thing. We'll see you on Friday. 5 to 11-year-olds, we expect a CDC approval within potentially 2 weeks. We've been preparing for this, similar to what we did with junior high school and high school. We've been working with our partners in the school districts to survey families to get an idea on what kind of demand there is. With the 12 to 18-year-olds, it took a little time for demand to build up. There's certainly demand right away, but a lot of families waited 2, 3, 4, 5, 6 weeks before they went and got their child vaccinated. So that's what we're doing right now. We're certainly gauging demand. Parents will need to be with their 5 to 11-year-olds. That will be different, and so authorization isn't enough. So we're going to be working to do clinics later in the day, whether the clinics are going to be in the school districts. We've surveyed school districts as well that want to host clinics, and we will work with them on that, or whether certainly we'll most likely have clinics at the on-center as well to meet the schedules so that parents can get their little ones vaccinated. Any pediatrician groups that want to participate, certainly we will work with them as well. We do understand that some of the groups really don't have the logistics to participate or the staffing. When you think about having to wait 15 minutes after a shot, try to physically distance in an office, very difficult. So, but again, if there is medical practices that want to participate, we will distribute vaccine to them as well. Just an update, last week I believe it was when we opened up the Heritage Lincoln Mercury site on West Genesee Street for testing. That's been a very successful endeavor. We're likely to expand the hours of operation there as this moves forward. The goal here is that we'll relieve testing pressure from the urgent cares so that they can relieve pressure from from the hospitals. And so certainly people, when you get sick, you want to make sure if you don't need to go to an emergency room and you can go to the urgent care, that's where you go. So we're all correlated here as the pandemic has had pressure on our medical infrastructure in different ways at this point, 19 months in. So that's the goal. So we'll likely be expanding hours so that more testing can be done here, frees up more capacity at urgent care to treat patients for other things other than COVID testing, which should help our emergency rooms in our hospitals. One last update that is relevant, then we'll take some questions. Our surveillance testing program in the school, what we've seen is the data has been quite consistent. The positive rate has been well under 1% now all school year. And what we're now going to do, before when we had a positive in a pool, we would quarantine all of the tests in the pool until we got those pools retested. So if you were in a pool and you were a child before, if you're in a positive pool, even though you weren't positive, you were quarantined for a short period of time. Now, because we have the data to merit it, we will not be quarantining the pool. We will test the pool. This will help keep, obviously, our healthy children who were just in a pool in school. And so we're comfortable with this decision now that we know the transmission rates are so low. So this will be helpful. And also, hopefully, more parents will be willing to allow their children to participate in the pool testing now as well. The kind of quarantine situation has been clarified. So happy with that, but happy to take some questions as well.
Hi, Ryan.
Hi.
Just a question about the 5 to 11-year-olds just awaiting the vaccine approval. Lots of discussions have already happened, but can you just expand on potentially having some clinics be centralized for different school districts throughout the county at the on-center you mentioned?
Yeah, so we'll do clinics certainly in the school buildings and for some of the districts, so that will happen. But we will do clinics likely at the on-center. We're even willing to have pediatrician groups who want to participate but don't have the physical space to use the on-center and have designated areas for different medical practices. So the idea here being is we're trying to make things as comfortable for the children, at the same time with the hours of operation that parents can get their kids there, or guardians. And so it will be an all of the above approach. I'm sure there will be some pediatricians who want to do it at their offices, and certainly we'll distribute vaccine to them as well.
With the school districts, for those who want to provide a site for their communities, is it just limited to their own particular school district, or can folks from all over go to, let's say, ESM or Liverpool, et cetera?
So what we did last time is we actually had regional facilities where you would have a larger school district would have their own. So Liverpool had their own. West Genesee had their own. Well, West Genesee actually brought some other kids in. Cicero, North Syracuse, their own city school district combined. But we would have them in Marcellus and take kids from Elbridge and from Skaneateles. And then I think in DeWitt we did some of the eastern side of the county schools. So I'm sure we'll look at those regional type centers, again, based off of demand. So certainly if there's enough demand in a district where we can fill up a clinic, 150, 200 slots in a clinic, they'll get their own clinic. But if there's not enough demand, we'll try to probably pair school districts, again, logistically, like we did for 8 through 12.
Heritage mercury, is that symptomatic, asymptomatic, and how many tests are you doing, and how is it impacting the whole system?
Yeah, so we've been doing at least 150 a day so far there. It is symptomatic. It's a saliva-based PCR test, and the results are coming back quite quickly, 12 to 24 hours. And so that's worked very, very well. We're considering expanding those hours and expanding kind of right now. Remember, we have the Boys and Girls Club at Hamilton Street for essentially kids who had other symptoms. Go get your test so you can go back to school. We may merge the two sites. We'll make that decision later. Demand at the Hamilton Street Boys and Girls Club has been down a little bit, which is a good sign, and that would make sense when you look at our COVID numbers too. So we want to expand that site to try to continue. That's one of the things we can do to help people. What can you do to help your hospitals? This is one of the things we can do. We can build up testing infrastructure, which alleviates pressure on urgent cares. We don't have nurses here that we can go send to the hospitals. This is something that we can do, though.
And you mentioned merging sites. Is the Water Street testing site, is that going to a different area?
So that's not our site. I believe that's an upstate site, and that might have been. I might have read that they might have been going to the fairgrounds or whatnot. So, but yeah, that's not our site.
Right. So far, October has been now the deadliest month since last February, 8 months. What does that tell us of the virus, and particularly heading into winter now?
Yeah, I think it's what we've learned is that it's a lag, right? So when you get active cases where we were, and our active cases today are at 849, which is a huge drop off from even last week. But I think for a period of time you had 1,600, 1,700. Remember, in this process we've had a couple senior facilities that had clusters, right? We knew, unfortunately, when that happened, that was going to create problems for us, and I think that was 2 weeks ago. So I think we're starting to see some of those challenges now over the last week here. But it's a deadly virus. It's a respiratory virus. If you have underlying conditions, which tens of thousands of people in our county do, it's not just like there's 1,000 people out of 476,000 with underlying conditions. Tens of thousands of people do. You really need to take all the proper precautions and mitigations. You need to get vaccinated. You need to get your booster shot. The boosters are there. The data shows that if you are immunocompromised, you probably didn't get that first full blast of immunity that others did. So please get out and get these shots. But overall, Glenn, I think where we are is I do think we're at a pretty positive turning point right now. Related to what the data is showing with new cases. Even our positivity rate, which I don't take much credence in anymore because it's symptomatic testing essentially. So you're just testing sick people. It's not a community positivity rate. Dropped drastically last week. Our cases per 100,000 were, I believe, the last 24 hours were almost under 25, which I think even gets you below what the CDC levels look like. And I think over the 7-day average, I think it was about 31 or 32 per 100,000, which is much, much better than where we were. So that should, if we continue in the right direction, that should bring us to a point where we're seeing better outcomes in hospitals when it comes to loss of life, especially with the boosters coming out, and especially with the 5 to 11-year-olds getting that opportunity to get vaccinated. Those have been, that 20% of our cases were under 11 years old. So these are all areas where we can play offense. The defense we need to continue to play is certainly when you're indoors. Things that we're better at this year than we were last year. We have better therapeutics this year than we did last year. When one of the most underrated mitigation tools that we have, that businesses have, is air filtration. And certainly we're better at that. Companies have invested in the infrastructure to keep their venues a little bit safer. But we've been saying for a long period of time that certainly when you're going to be around a lot of people indoors, you should consider mask wearing, and specifically masks that work better than others.
Ryan.
Yep.
Syracuse University announced last week that they would not be moving out of the red level masking tier, despite COVID cases dipping below 20 on campus. They say that COVID is still too high in the county. Do you believe that it is?
Yeah, I think right now the roles are reversed this year compared to last year, right? So at one point last year on campus, there was cases in the university before you had the vaccine were higher essentially than the community. That's not the case anymore. So the students are still out in the community. So I think right now, and this is where the pressure and the public sentiment is going to start to turn. Because if the data continues to prove out, you're going to see cases continue to drop for a period of time. And then people are going to be saying, unmask, do this, where when they were rising, people were saying, go mask, go mask, go mask, go mask. And so I think that this is just a balance. I think Syracuse University is probably wise right now. You have congregate settings to continue with their policy that's worked so effectively to date.
And what case level in the county do you think that SU should change their masking policy once we go below that?
Yeah, I think so. You could have a situation where we have a great week here and then another great week next week, but then you're going to run into a couple things, right? You have Halloween. Last year, Halloween was the start of the most terrible months of this pandemic. So people should be very conscious of that, even if you're vaccinated, that outdoor events are better than indoor events. And they should take that seriously. But then you have, even if you got good data for 2-3 weeks and then it looks like you can lighten up, then you got Thanksgiving right around the corner, and it takes you about 2 weeks to really see what happens from Halloween. So I think we're just in this period of time where it looks like we're starting to make some real progress. We just need to be smart. And, when it comes to certainly congregate type settings, because that's where we know the virus can spread the easiest. So I think the university just needs to hang in there for a little bit here, and let's see how we get through November. And then if we're getting through November, we're still in a great place in the community and on the campus, then I think certainly the chancellor and their team have a decision to make.
And County Executive, back to testing for kids. We know you had mentioned this, and doctors have said that getting these 5 to 11-year-olds vaccinated could be the difference between, another issue this fall and this winter. For those parents who might be a little bit hesitant, I'm not exactly sure what your plans are for your youngins in that age group, but what would you say to them about this vaccine and what it could do?
Yeah, I would say talk to your pediatrician and talk about the pros and the cons. And I think certainly I have an 11-year-old daughter, and she'll be getting vaccinated. So that's our decision. I understand every family needs to make their own decision, but it is a tool. When you look at where the cases are, the virus finds unvaccinated pockets. It's amazing. Look at your ICU numbers. I mean, this is an amazing 88% of the 26 in the ICU. When you have really about 17% of the community now, 18 and above, isn't vaccinated, and that's driving over 60% of your hospitalizations, over 60% of the loss of life. So the vaccine is effective, and certainly Delta, I think, surprised everybody when you had the breakthrough cases, but it's extremely effective at keeping you out of the hospital and out of the ICU room. So talk to the pediatricians, talk to your doctors, be comfortable with your decision. But I think we'll get 30 to 40% participation right away, is my guess. And then I think you'll probably see it slowly getting over 50. And that's a lot of that's a lot of people, right? And so that brings in a lot of new immunity to the county.
Ryan, with Nutcracker and Disney on Ice now being advertised in the on-center requiring either vaccination or proof of negative COVID testing, is the county expecting any sort of surge in demand for asymptomatic testing and planning any sort of support for events like that?
Yeah, so we're doing twice a week with asymptomatic testing, and we'll continue to do that. We'll expand it if the state gives us the clarification that I don't need certain personnel on staff to do the Binax kits like we did before in the last surge. We would love to expand the asymptomatic testing. So if we can get that clarification from the state, which I asked for about a week ago, we'll expand that even more. Maybe we'll probably start 3 days a week. We've done 3 days a week of asymptomatic testing when there's been large events in the community. But it's a great tool for people to get a test, make sure they're okay. Certainly going into Thanksgiving, we'll probably expand that even more when they're going to be together, when families are going to be together. So we just need a little bit of clarification that the challenge is there's language that I think the intent is for the state to give us flexibility with who can be there managing the testing. You need certain accreditations right now. In the second round of this, when we were really in tough shape, we had a waiver on that, so we could create teams. And these at-home test kits, really, you can get them and do them at your home. We would need, you could have anybody trained to do it, and that's where we really need to be again, moving into the winter months.
Have you given up on folks that are hesitant and won't get vaccinated?
Yeah, I think Ellen, I think in the beginning of this, we always thought, at least, certainly the predictions have changed, but we always thought if we could get to 70%, that was going to be enough for herd immunity. We're probably there when you count in natural immunity plus the vaccination rates for the whole county. And it looks like we got to be higher. So I think after you have the 5 to 11-year-olds vaccinated, we'll see, and as the Delta slows down here, we'll see what that vax rate plus that natural immunity, which is there. I mean, we've now had over 51,370 confirmed cases. Most experts would predict that you may have had double or triple that number from above confirmed cases. So I think when you look at the two, once we can get to the 5 to 11, hopefully we'll get in that range where we'll start to see this kind of transition to an endemic.
Just a clarification, with the 96 people currently in the hospital, the 88% that are unvaccinated, is that among the 96?
ICU, 26
okay,
in the ICU.
Thanks.
When do you expect to get back the survey from the schools, and how is that going to frame your response to vaccination?
What it will do is we'll know based off of the demand in each district if they need their own clinic. And if you have 2 or 3 that are regionally closer together, and we'll try to have a regional clinic for those kids at those schools. When we get them back, we know we pretty much know the dates these things will get approved or not. So we still have a little bit of time here to work through those logistics with our emergency management team and the districts.
I've heard some stories about people aren't getting flu shots because they're so worried about getting boosters for COVID. Does that concern you? And I mean, do you ever think of throwing a little
Yeah.
Flu shot back, or, clinic in with the
I'm
cold
supposed
one?
to get mine. When am I getting mine, Justin? Okay, all right. I'm scared of needles. I'm a big baby. So I got a flu shot, I think, last year for the first time. And so I'll get my flu shot, and then at some point I'll be maybe eligible for my booster here too. So I'll get that as well. But I think overall that's one of the concerns is that last year you didn't have a lot of flu, if any. You had a little bit. And this year, people's habits have changed again, right? We're living life again. And so there is a concern that just from a medical infrastructure standpoint, there's a lot of stories being written about, what's going on in hospitals. What's happening is pandemic driven, but it's not necessarily COVID driven right now. Worst case, we had well over 300 people in the hospitals last year. We have 96 today, and that number will likely decline. You have new people come in every day, and new people get discharged every day. But you have the impacts of the pandemic really having an effect with staffing issues, with fatigue, and certainly competition for your staff has a huge impact. Mandates to a degree as well have had an impact. So everything you can do to try to keep yourself out of the hospital is good for you, but it's also good for the community. So certainly the flu shot is something we encourage people to take time for and get. Anything else? Thanks, everyone.